So why are we here and why are we talking about men's health? Number one, I think men's health is a serious problem. I think healthcare in America is changing. Forget about all the insurance issues, etc. But in general, you have to be your own advocate. And when these guidelines are changing and they're so fluid, men are really confused. And they really don't know what to do. What should I get screened for? At what age? What test? You go to a doctor, they may think it's liability and not get the test. You go to somebody else, they're going to take 1,000 tests on you. So there's no universe. So you have to be in charge of your own health. And that's really important. I think, when you look at some of the fast facts about men's health, you see the seriousness of this problem. 35% of men 20 years or older are obese, according to CDC, and a third of them suffer from blood pressure. So there are 3 diseases excuse me, that are going to get us: heart disease, cancer, and accidents. So let's talk about heart disease and cancer. I think the cardiologists have done an amazing job over the last many years to reduce the risk of heart disease. Your cholesterol medications, awareness about cholesterol, fixing your blood pressure, making sure that you get your cardiac stent on time. Our bypass surgeries have improved. So the heart disease, if you look at the next graph, you see that it's coming down and you're going to end up living longer. How many 80-year-olds and 90-year-olds we're seeing in our office that are coming in that we never used to see. So as heart disease goes down, the number of cancer patients are going to go up. If you live long enough, you're going to end up having one of these cancers. The second factor is that the aging population in America is getting older. As I just mentioned, we're seeing a lot of 80s and 90-year-olds, which is fantastic. We're prolonging life. We're taking care of them to live longer, but then we have to now deal with the issues that are coming up, and that's really important. So looking at this, the men's health is a major, major issue. In the past, we have talked about breast cancer versus prostate cancer. And I think you already know by now that the statistics of those diseases are almost identical. Look at the statistics of prostate cancer versus breast cancer. 2 diseases, one has tremendous amount of awareness and the other one not as much. Excuse me. 230,000 on both sides. You can see 1 out of 7 men, 1 out of 8 women, and you can see are diagnosed with this disease. 14% of all new cancers, on and on. So these 2 diseases are the same, but women actually go for screening and they go for mammograms because remember, they were more detail-oriented. And when the news broke out a few years ago that, you know what, forget about mammogram. You don't need to have it. We're going to delay it for another 10 years or so because it costs too much. It doesn't detect the cancer. Guess what happened? Look at a picture of the women out there in the street coming and demonstrating, you're not going to take my mammogram away. And they fight back and they fight back and they get what they need and they're in charge of their health care. Do you want to know what happens when the U.S. Task Force talks about no PSA screening? Don't laugh, but it's true. And unfortunately, I might be one of these people in the picture. This is how we celebrate. Great, wonderful. Leave me alone. I don't need to get my test. As long as we have our beer and when football game is going on and some hot dog, we're happy. Again, don't mean to undermine the brain power of men, but the truth is that we're a completely different species and our emphasis is totally different. Let's go to the videotape. You're going to make it laugh. You're going to be having fun with this and see how we think different than women again.
Nou, dit is dus de huiskamer. En dan komen we hier bij de slaapkamer. Oh ja. Met...
How many shoes my wife has in her closet. I think I have to give up one of my closet just to keep the shoes. But the truth is that women are sensually different, they emotionally different, and again, their emphasis is totally different. And again, we see the example of how we think versus this. And this is the reason why this month is important to really tell guys out there, be in charge of your health. Go out and talk about it and have a conversation. Look at the difference between like their emotion, how they think, and what's important to us.
Crown Premium Light. Some drink it because they're responsible.
What?
Others just love the taste.
I thought you'd get a kick out of that. But the bottom line is, that's how we think, that's how it is different.